Can you hear me? Hello?
Yes, doctor.
Great. I will start to share my screen right now.
تمام. السلام عليكم. I'm Rani Filati, together with Aisha Al-Ghanem, members of the Alumni Unit. We would like to welcome you guys to our lecture, How to Write a Case Report, presented by Dr. Dunya Faraj, a physician ER consultant at King Fahd Hospital University, and who's also leading the research unit at our hospital. If you have any questions, write them in the chat. The doctor will answer them at the end of the session with the help of Aisha. And please note that the attendance will be counted from the feedback link, which will be sent at the end of the meeting through the chat. So please remember to fill it. Hope you get the most after the lecture. Best of luck. Please start, doctor.
Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. Can you see my screen now? Can you see my screen? Hello?
Yes, doctor.
Yes,
Okay.
doctor.
Okay. So I will proceed with the introduction, and thank you for this invitation, kind invitation. And I hope that you will take a benefit at the end of the lecture. But please, regarding the organizing team, if my connection lost at any time, just call me on my mobile. Because while I'm sharing my screen using my iPhone, I couldn't see any comments in the chat or raising hand or following my WhatsApp. I will start my presentation, and I'd like just to go through it very fast and finish it in short time, because what I like to do this session an interactive session. So I'm welcoming to receive your comments and your questions at the end of the lecture. Just from these lectures, I want to give you a quick handout that you should follow in writing a case report. And initially, when we would like to write a case report, the first things you have to know that writing a case report, it's not something impossible or something hard, because you know that most of my case reports is written by juniors, either medical students, intern, or resident. I'm just supervising them and guiding them to write a case report. And even in some case reports, some of them, the first author is medical students. So really, it's not hard. It just needs some guidance. So to start, how to write before talking about how to write a case report. What do you know about case report? So case report is a detailed report of the symptoms, sign, diagnosis, treatment, and follow-up of an individual patient. So, you know, as you are medical students, some of you are seniors and starting in clinical practice, and you are when you are writing a case presentation about any patient that you see and you like to discuss it with your senior, this is exactly what you are doing in writing the case report. So writing case report is writing about the medical history, examination, investigation, treatment of the patient. And why do we write case report? Yeah, this is a very important question. Is really case report is an important and deserve to spend time in writing a case report? Because, you know, some of the researchers or literatures, they found that the case report is not a research. So they consider it as it's not real research. But I'm not agree with them in this, because writing case report is very important. Why? When we saw any case report in our practice, when I saw a case which is like unusual case or strange case, odd case, not like the case that I'm usually see. When I'm sitting with my colleague, I will talk about that case, because this is really not usual case, or not like what we see every day. So really, I want to share with them my experience with that case or my input in that case. Can you hear me?
Yes, doctor.
Hello? Okay. So I want to share my experience in that case. I want to talk with them about what's unusual. But if I'm talking with my colleagues regarding that, what the benefit that I will add? But when I write it in case report and I publish it in a future in a journal, this is really what matters, because you know that I'm sharing my experience with the world, and I will add an insight in a medical field, and this will last forever. And all of the people that will read the case report, maybe they will just enjoy it, or maybe it will add to their practice, because you know what we say, that the level of the evidence, which is an experience, expertise opinion, case report, you can consider it as an expertise opinion, and even more, because we will share it with the literature review and so on. So case report usually describes something unusual or novel occurrence, and it's remain of the one cornerstone for the medical progress and provide many new idea in medicine. It's really turn an interesting case or unusual in this pictures. No one will disagree that this is something unusual. And this is exactly, remember, when you are writing a case report, remember these pictures. Is this case report really unusual? Is it something new? Does it deserve to write it? And maybe this is what you are usually need from your mentor or supervisor. So your mentor or supervisor should have an experience in that field. So maybe he is the most one will know if this is really unusual and deserve to be written. As we said, so it's a common practice in the medicine. When we come across an interesting case with unusual presentation or surprise twist, we must tell the rest of the medical world about this case. How can we convey this? How can we deliver a message through writing the case report? And this is how we continue our lifelong learning and aid faster diagnosis and treatment of the patient. Because, you know, sometimes when we are experiencing like unusual cases and there is no good literatures in that field, even when we go back to the textbook, nothing mentioned about that case. So when we are searching in the net, only what we found is a case report, which is similar to the case that we faced at that time. And believe me or not, sometimes we are managing the patient based only on the case report, because this is what we have. This is only what we have, nothing more. So we are managing, then we are writing our case reports. So we really enrich the medical field, because the next physicians, when they face the similar cases and they find like 2 case reports, and they will still follow our managements, because if I am the second one that's writing the case report and show succeed, and the first one shows succeed, so maybe someone will come in the future and they'll like do a case series, then they will do like clinical trials, will test our theories. So this is really something deserve to think about it when we are writing case report, just to know that writing case report is something very important. So some reports contain an extensive review or relevant literature on the topics. So some of the journals will accept only case report plus literature review. So what does it mean, literature review? I believe that most of you know what is a literature review. So when we are doing literatures and we are talking about the similar cases and comparing with our cases, or sometimes Sometimes we are doing literature review and we cannot see any cases, and this is per se, it's a literature review. This is can be added to the case report. So when you want your case report to look in more advanced, or you want to make it more beneficial, so you will add a literature review to your cases, and we will talk later when we should put a literature review in which section of the case report. So case report is a rapid, short communication between busy clinicians who may not have time or resources to conduct large-scale research. So during the busy times for our researchers or the clinical physicians, when they don't have time to do a big research like clinical trials, because it will take consume time and need monies. Applying for to get an IRB, that's also will take time, collecting data, analyzing data. All these researches is taking this time. So it's case reports is a very good thing for the busy clinicians when they don't have times, because it doesn't consuming times. I couldn't say doesn't consuming times because it's need time, but doesn't consume times like other research. So it's a good thing for busy clinician. And what are the reason for publishing a case report? And this is very important when you want to choose the topic of the case reports, or you want to choose the case to be written as a case report. So for example, if there is unexpected association between the disease or symptoms, if the patient presents with unusual symptoms, this deserves to be reported. Second things, if there is unexpected event in the course, observing or treating patient, for example, when we are expecting that the patient will die and he will not, or in the opposite way, we are expecting with good outcome, then we saw like a deterioration, which is unusual for such a scenario. This also deserves to be reported. Third thing, finding that they shed new light on the possible pathogenesis of the disease or an adverse effects. For example, if we are using some medication and there is unusual adverse effect of that medicine, it deserves to be reported. And sometimes even the company of that drugs will contact you and ask you more details, and maybe they will add this adverse events to their label. Also, there is like number 4, unique or rare feature of the disease. If the disease is presenting with as we said before, it's unusual for this also deserve to be reported. And if there is a unique therapeutic approach and variation of anatomical structures. For example, we faced one case in the last month that the patient presenting with intractable hiccup that lasts for 5 days and not relieved by any kind of medication. Then resident gave him ice and asked him to drink a bottle of water. Then hiccup all of a sudden disappeared. So we are reporting that case because this maybe it's not a new approach, but it's a unique and theoretical approach. If we write it as a case report, if somebody read this, they will consider this in their management plan, which is saving money, saving time, and avoid a lot of further unnecessary investigation. So it's very important to know what's the most journal publishing the case report. Why? Because, of course, if you are writing case report, at the end, you are aiming to publish it in a journal. So you have to know what journal is interesting and to accept your case report. So most of the journals, if they saw that there is unusual observation or adverse response to therapies, or there is any unusual combination of the condition that lead to confusion, because this is the most important things that we are writing case report when we are confused. Sometimes we are facing, even if we have a knowledge regarding that disease, when we are facing a specific case, for example, in our emergency department, and we are confusing not only emergency, also the other services, all of the physicians confused. Maybe after 1 month, we reach to the clear picture about that case that deserves to be reported, and really the journal interesting in such things, because we are confused not because we lack the knowledge, but we are confused because the presentation or the course of the disease is unusual and they really deserve to be reported. And if there is any illustration of the new theory, if you, for example, if you have a new theory, you apply it to your patient, you found some success for that, and you reported that cases, that's what journal interested in. And the question regarding, and the personal impact, as I said, if you do something for the patient which is unique and new, something like that, that's kind of the case report that the journal interested to look at it. So when you are starting to write your case report, first of things, just sitting with your medical team that will write the case report, learning the points that you like to discuss it in your case and highlight it. And ideally, a senior physician will mentor you and give you your guidance, because, you know, even if you read, if you do literatures, you need to take an expertise opinion in that case or in that disease, because with his or her own practice, they will know if this is really rare or unusual and deserve to be reported or not. As I said before, junior doctors, medical students can be involved in the case reports. We will talk later about the authorship. And I want to say something important regarding case report, because most of the institutes, they didn't necessitate IRB. So when you are writing case report, you know, sometimes you are writing a case report, another physician's writing the same case report, and you don't know, and he don't know about you are writing case report. So it's like nothing official written in the literature, so there's like guidance. But what I prefer, just to discuss the case with the primary physician that will take over for this patient, because, you know, if anyone want to write the case report about that case and discuss it with the primary physician, so I don't think that there will be any mix-up. Sometimes they prefer to work as a team. So if I want to write a case report, I have to go to the primary physician and ask him or her if they are interested to join us in writing case reports. Sometimes they said, yes, we are interested, but they have to put a major contribution and major input to be deserved as author. Sometimes they said, no, I'm not interested. I'm just happy to help. If you have any question, please come and ask me. At that time, we have to acknowledge them in the paper. Allocate job to split the workloads and deadline and work. This is before writing the case report. You have to agree about everything. Discuss the order in which the author will be listed from beginning, please. So if you are, for example, 4 or 5 in the case reports, and there's one important thing I want to mention it regarding case report. Case reports, it's better if it is not, if the authorship is limited, because most of the journals will not accept more than 4. Some of them will not accept more than 5 authors in the case report, because, you know, case report doesn't need a lot of effort. If there is a lot of authors, that's mean not all of them contribute significantly to deserve to be an author. Some journals, yeah, they are accepting more than 4 or more than 5, like 6 or 7, but they are very little journals that just to be sure that okay. All listed authors, I said, should contribute substantially with the person doing most of the work will be the first author. And usually the most senior team member will be at the end. So the last name in I'm talking now about the author or authorship. The last name in the case report, it is not a must, but most of the cases, he or she, they are the senior. And the first author, he is the one that contribute the most. This is the first. Doesn't matter if he is or she medical student, intern, resident, senior physicians, doesn't matter what the level is. The one who bought the major and the most contribution should be the first author. The last one is the senior, but not must, but usually the last name is the senior. Then we arrange the second author, third, fourth, fifth. It's depend on the contribution. So the second one, as a kind of contribution, will be the second author, and so on. But the agreement should be before writing the case report. There should be, for example, if I want to write case report and I have 3 authors will be with me, okay? So we will sit together and we will put an agreement. You will write the case, you will do the literature review, and also and writing manuscript, put everything together, is contacting the journal. So you are doing the major task, so you deserve to be the first author. Then the second author, you will dig in the case, summarize the case, collect the history, physical examination, blood work, management. Then you will deserve to be the second author. The last one, the third one, because you will do proofreading, you will help in anything that will be needed, so you will be the third author. And me, I'm a senior one, I'm supervising everything from A to Z, so I will be the last one. So there should be an agreement regarding the order of the authors before starting writing a case report. And another thing is important before writing case report is taking a consent from the patient. So take a permission from the patients. If the patient is a child, take the permission from the parents and keep a copy because you will need it later for the submission in the journals. Not all journals asking for the written consent, because sometimes we are taking a verbal consent, sometimes we are writing case reports later, not at the time of the presentation, and we can contact the patient only by phone, so we're taking the verbal consents. We couldn't take a written consent, and we will mention that in the journal, in the paper. Some journals, they are not accepting unless it is a written consent. So just in case, before writing case report, the patient is in the hospital, or you can meet him during follow-up in the OPD, write written consent. The written consent actually in our institution is there is a form for it. Just you will ask the patients to sign and keep that copy with you. Maybe you will need it during submission to the journals, and it will protect you. The informed consent will protect you, because, you know, if patient, for example, saw his case in the internet or photo, and maybe they will complain against you, the informed consent will protect you in that scenario. So informed consent is an ethical requirement. Most of the study that involving the human, before you start writing your case report, take a written consent from the patient. As I said, Not all journals, but most of the journals require that you provide it at the time of the manuscript submission. Sometimes there's like when you submit the manuscripts, they will ask for the written informed consent. As we said, if the patient is minor, the parent will consent instead of them. And for the adults, sometimes the adult is too sick or too old to sign. For adults who are unable to consent to investigation or treatment, the closest family member is required to sign that consent. It's very important. Patient anonymity is very important requirement in the case report. So please, if you are writing the case report, just remove any identity of the patient. Or even if you are using pictures for that patient, try to minimize it to your purpose. If it's not necessary to show the face of the patient, so don't show it. So keep it to a minimum. And remember not to disclose any information that may reveal the identity of the patient, because sometimes, you know, the case is unique. So anyone will read, will know that patient. So just to try to not indicate to identity of the patient in any how. You need to particularly careful with the pictures and ensure that the pictures of the affected area don't reveal the identity of the patient again. Pictures also need an special consent, and you have to tell the patient clearly that your pictures will appear, because you know now the pictures, not only in the journals, because it's automatically will be in like in a Google pictures. So just tell the patient that things very clearly, so there will be no any embarrassment for the patient when he saw his pictures in the internet. He will know that he will use the pictures and he agree for that, and he have to sign for that. After that, you have to gather all information from the medical note, hospital electronic, including the copy of the blood test. And as we said, anonymize any data, because you know sometimes we have to take the pictures of the CT or X-rays or any image, and there will be a name of the patients and the ID of the patient. So you have to remove all of that. So be careful. So when you write the case report, you have to emphasize on the interesting point of that presentation, and that will make it interesting for the readers, and it will make publication in the journals more easier. And get input on the case from all members of the team and highlight their involvement. This is what we mentioned in the authorship. For example, if the physician said, I give you the image of the X-ray, يعني withdraw it from the computer and give it to you. Of course, he will not deserve to be authorship. Yes, maybe you can acknowledge them. Thank you for his or her helping. So during writing the case report, just highlight the task for everyone. So even if we have an agreement that you will be author from beginning, then he or she didn't do their task, I can withdraw them from the authorship. So highlighting the contribution of every members is very important. So that will help us at the end to order the authors. And include the prognosis of the patient, if known, as the reader will want to know the outcome. If the patient, for example, died, improved, his disease cured. So now we will start to know how to write the case report. And as I said, I will go through it very quickly. So I will leave time for your comments or your questions. So title is very important. Why? Because, you know, most of the readers will read the case report after reading the title. So if the title is not impressing or doesn't indicate to the main problem, maybe they will not read it. And it is also important, the title for the citation, if you want your paper to be cited, because when somebody do literature review and they will take information from that researches and add it to their paper, then they will cite it, they will add it to the references. So how they can find your case if the words, the keywords not written in the title, they couldn't reach to your paper. So discuss the title with your supervisor, because it's really matter, and other member of the teams, as this provide the focus of the articles. Sometimes we are spending time to choose the correct and appropriate title. So it should be concise and interesting, but should also enable people to find it in the medical literature's search engines, as we said. So what is the structures of the case report? Different journals have a slightly different format of the case report, but most of them, they have the same structures plus minus. So it's always a good idea to read some of the target journals that your case report will be, you want to publish your case report in that journals. Because, for example, if American Journal of Emergency Medicine, this is my target journal. So it's a good idea to read the guidance for the authors and go to the case report section and to see their condition, maybe the structures they advise to it, or to read some case reports that written in that journals. That will give you an idea. In general, all case reports include the following components: an abstract, introduction, case report, and a discussion. I didn't write conclusion because sometimes conclusion will be at the end, the last paragraph of the discussion, and sometimes it is as separated. It's depend on the journal. Some journals may require a literature review, so they didn't accept only case report. They should be case report and literature review. So abstract is, this is a very important, because abstract, this is what you are, for example, presenting in the conference or in as a poster. And sometimes the reader will read the abstracts. If they find that it's interesting, they will write a complete paper. So abstract should summarize the case. You have to mention the problems in a brief, but without missing any important information and the problem that your case address, and should be no longer than 100 to 200. So on average, it's like 150 words. And it should highlight all points, all important points in your case. This can be harder than writing the full article and need special care, as it will be used to judge whether your case is accepted for presentation or publication. So you have to be very careful in writing abstracts. Then you will write introduction. So you will write like paragraph, one paragraph or two, to highlight the relevance of your case report in relation to this. So one paragraph or two, just to convince the people why your case report is unimportant. If you are struggling, always seek advice from senior. Even if there is no senior joining you in case report, you can ask. Most of the people are helpful. And how to do literature review, I think this need another lectures. Most of you, I think, know how to do a literature review to see a similar cases. So to write introduction, as I said, 1 or 2 paragraphs, just to explain what is why your case is important, and what is the relevance of your cases to similar cases, and why you are writing this as a case report. So the introduction will give brief overview of the problem that the case address and citing the relevant literature where necessary. And the introduction generally end at the end, just a single sentence that describe the patient and basic condition that he is suffering from. So, for example, my patient has this disease, and if the management is unusual and managed by this. After you are writing the introduction, you will write the case itself. So as I said, as you're writing the case presentation in your practice during your medical students, so you will write history, examination, investigation, treatment, if there is any outcome. So the author should ensure that all relevant details are included and unnecessary when excluded. So I shouldn't write all information in the file of the patient, only what is relevant, what is important to our case. So don't miss any important things, and don't make your paper confusing and busy with unnecessary information. The last part of the case report is writing a discussion, and the discussion is really the most important part of the case report, because this is what will convince the journal about the case and if it is really worth to publication. This section should start by expanding on what has been said in the introduction. So discussion is as continuation of what you mentioned in the introduction. So in your introduction, you will do like, you will write a brief about the disease that you will talk about it. At the end, you will give a brief summary about your cases, and also you will mention why your cases is important and what is relevant of your cases to the similar cases in a brief. This is an introduction. Discussion is, it is like a continuation of what is written in the introduction. And it will focus on the problem. So you will talk a little bit more details about your cases. And this is followed by a summary of the existing literatures on the topics. Yes, I mentioned some of the literatures in the introduction, but that will be in general. You will be more specific in the discussion. So you will write about the similar cases, what is the similarity, what is the difference from your cases. Sometimes journals specify a separate section of the literature review. If they ask for this, you should write a literature review before discussion part. But if they didn't specify, you will mix it with a discussion part, a literature review. So this part will describe the existing theories and research finding on the key issue on the patient's condition. Again, you will talk about the similar studies, how they are different from your study, how they are similar. On to the source of the confusion or the main challenge in the case. Yani, it's very important to write what is the main challenge in your case and what was the confusing part and how you solved that part. As we said, that the case report should be connected to the literatures and mention the message that the case convey. What is the message of, from your case? And the author should explain whether this corroborate with or detract from the current beliefs about the problem and how this evidence can add value to the future clinical practice. Yeah, and this is the message from, you have to mention the message, why you are writing the case reports, how it's different from other practice, and how it's similar to them, how the clinicians can take a or take a message from it to use it in their clinical practice. The conclusion part sometimes will be the last paragraph in the discussion, but sometimes you can write it in a separate subtitle. It depends on the journal requirement. So case report end with a conclusion or with a summary points, depend on the journal specified format. The section should briefly give the readers the key points, converted the case report. What's your message? Why you write case reports? So what the clinician should do and what they should remember, what they should consider if they face something like that, and what you suggest in the future. So they can give a suggestion, recommendation to the clinicians, to the researchers, to the teachers, because sometimes we are writing only for an educational purpose. Some journals don't want a separate section, as I said, in the conclusion. It can be at the concluding paragraph of the discussion section. It should be the last paragraph. At the end, and last sentence in the conclusion, just you will explain why your case report add to the medical literature and highlight any learning points or a message. After that, you want to present, when you finish writing a manuscript, you want to present a case report, maybe as a poster in a conference, maybe in a specific, as a specific paper, maybe locally within your institution, in the department, in the team meeting, at the hospital ground round, or in the journals. But in the journals, just be careful to write according to their format. Sometimes, yes, we are writing, we are sending to the journals, then they ask to edit it if they are interested in the topics, but they are not like format. But I prefer before submitting to any journal, just write their style format and follow them. This is my reference for the lectures. And just I want to show you that the writing case report not hard. I will show you quick archive of our clinical case report in the last 2 years, just the published ones, because we are still writing. We have working in a lot of case report, but this is what was published in the last 2 years. Most of them is written by juniors, medical students or interns, and all of them are supervised by me. So around 15 case reports. And if you want to read them fully, you can follow my account in ResearchGate, because I put them, all of them there. And thank you for your listening. Now, if you have any question or comment, please don't hesitate.
Thank you, Doctor. It was a very enriching lecture. I hope that you all got the most out of it. Please, if anyone have any questions, write in the chat or just open your mic.
In the chat, there is one comment. I cannot see your slides. Did you see the slides when I present? Okay. Okay.
There is a question, Doctor. Faisal Al-Ghamdi, he says, thank you for the presentation. I have a question on how I can take consent for case report that involves an expired patient.
Thank you for this question. And actually, we write case report for an expired one. As I said, if you cannot take the consent from the patient directly, if he's very sick or very old, it will be the same scenario for expired one. So you can take the consent from the closest person to him, family. For example, the case report about the expired one, we took the consent from the both father and mother.
Doctor, another question, Fatma. She says there is a lot of info to write and there is a word count. So what should we focus on?
Because the case report should be in brief. Just imagine yourself as a reader. This is what I always say to my students. just imagine yourself, you read this case. So if it's really very long regarding case reports, it will be boring and maybe confusing and a lot of unnecessary information. So to be as brief as you can without missing any important information, and you can remove any unnecessary information, and that's work. That's work. And when we are writing case report, we didn't find any problem regarding the counts. And believe me or not, if you are exceeding the number that is dedicated by the journal, that's mean you are writing unnecessary informations. So go back to your, at the beginning, the first draft, you write everything. Then you will read it and the team will read it. Then they will add, they will remove some information. They will add another information. At the end, when you finish it all, and you are at the point to contacting junior journals, and you found that the numbers is exceeding what they request for, try your best to minimize it. Remove any unnecessary, because I shouldn't put all the patient file in the cases. And I shouldn't repeat myself. Sometimes somebody's write the introduction, then they write the discussion, they just repeat what they write in the introductions. I said before, the discussion just be only as a continuation of what is written in the introduction. So it will not be a problem. You can do that. You can remove unnecessary informations, or sometimes the sentence is long, the 3 lines. You can just summarize it in 1 line, and you will deliver the same message. Mm-hmm.
Doctor, another question. He says, when we talk about the case reports, we mainly talk about the unusual presentation. How often do we see the unusual presentation?
As I'm working in emergency department, there is a lot of unusual presentation. But do you know what's happened? Usually we are missing very interesting and unusual presentation, and this is what's happened usually. Okay, so for me in emergency, there is always unusual presentation. Myself, I found at least once per week. If I'm working 1 week, at least I will see once per week. And what I do because I said before, always share it with senior or with expertise, with the one expertise in that field, because the physician, when they faced a lot of cases. For example, I have pulmonary edema. I saw it every day in my shift for 10 years. But this is the first time I saw this kind of a presentation. So of course, that should be unusual. And after that, just do quick literature review, very quick. And I found really that this is something unusual. Maybe it's reported only once. So that will confirm that my suspicion is true. This is unusual. Then I will start to report it. Regarding sharing the slides, actually, because I'm just sorry for that. I'm writing in quick. So I promise you that I will summarize them, and maybe I will add more. Then I will share it with you. So it's not good now for sharing.
Thank you, Doctor. Another question says, if there is another case report outside Saudi Arabia with same signs and symptoms and same treatment of my case, is it okay to write the same case report?
If this is reported, if the things you saw is it reported recently, that's mean yes, of course, it's deserve to be reported. That's mean it's really rare. That people, of course, they do a literature, they found it's unusual, and the journal, when they accepting their case, the journal agree that this is unusual. So this is confirmed that your case is unusual. And you know what is a case serious? Is a case serious? It's a collection of the case reports. So when somebody want to do a case serious, they will take your case and their case, then they will put together to make it a case serious. And this is the start to do it later as a guideline or as enhances people's to do clinical trials based on the case reports or case series. So the answer is yes, you can.
Thank you, Doctor. I think it was the last question. Very appreciated. It was very enriching lecture and important topic, of course. يعطيك العافية.
Allah يعافيك. Just I want to add one more things. The most difficult part in writing a case report is how to collaborate with teams in the hospital. So we are not working alone. This patient is not ours or theirs. So please, before writing any case report, just to try to contact other teams that are involved in the case report. That doesn't mean that they have to be with you, but just to let them know that you are interesting to write a case report. If they're really interesting to join you, they have to make a major contribution as you did to deserve to be author with you, and this will let you avoid a conflicts later. Because, for example, one of our case reports, we write it and there was another service involved in it. When they saw the case in the journal, they became very upset and they contact the journal and ask the journal to withdraw because they said that they was about to write, they intend to write the case report. Actually, that was 9 months after seeing the patient, which is not sense. So at the end, yes, there was a conflict, but it was solved. And they write with us, but just to avoid any kind of conflict, this is my advice. It's kind of respect, discuss it with others, but you have to make agreement from beginning that you will not be authors with us if you didn't put a major contribution, because there is no like guidelines who should write the case report. If I'm emergency, the primary physician is internal medicine. Who should write the case report? Is the internal medicine that treat the patient? Is the emergency physician that the face the patients? Sometimes, for example, internal medicine said, I will write the case report, but you shouldn't write it. They cannot say like that. As I said, the patients doesn't ours and not theirs. And sometimes, yes, we can. The case reports couldn't be written twice, the same for the same patient. But for example, can be written from our perspective, and they can write it from their perspective. It's okay. For example, what is interesting in the case is the presentation in the emergency, unusual presentation. So I can write about unusual presentation, and for them, what was unusual that the medicine they gave was effective in unusual way. And they can write about, in this case, yes, we can write it as a separate team. Sometimes the radiologist just will show us an arrow to the finding, and he said, add my name to the case reports. Our pathologist give us a slide for biopsy. I will give you a slide, a picture of the biopsy, but you have to put my name. So all that's not correct. So you have to be careful. So what is more important than writing a case report? Just sit before writing the case report. Just sit together with your team and make an agreement for every things, and refer back to the primary teams and inform them that you are interested the other teams that in the same hospitals, because you know any team, maybe radiologist, maybe internal medicine, maybe a multi-teams involved in it. But you don't have to go around all of them, just discuss it with the primary physicians and let him know that you, or her, to know that you will write that case. As I said, if they are interested, they can join, but they have to put a major contribution. If they are not, that's fine. If they want to help, but without putting a major contribution, just acknowledge them at the end of your paper. And thank you.
Thank you, doctor.
There's no any more questions, so can we end the meeting?
Yes, thank you, doctor. We'll end the meeting.
Okay, and you feel free to contact me anytime if you are interested to write case report, or if you have any confusion, or if you need any advice or consultation.
Doctor, what's the preferred way of contact if you want
لحظة
to...
1 minute. Yeah, I couldn't hear. Yes.
What's the preferred way of contacting you regarding the attendees if they want to contact you or send you an email?
No problem. WhatsApp or email. Both of them fine with me.
Can you write your email in the chat, please? Or the same one that we contacted you?
Same one. I can write it now.
Okay.